Namaste. My name is Dr. Sarvada Makazu, working as an assistant professor in Department of Anatomy. This is my first video I have uploaded in YouTube. Hope you're going to like it and subscribe my channel. Today I'm going to talk about the anatomy of diaphragm. The diaphragm is the large dome shape. This portion, what you have seen, this portion is known as a diaphragm. The diaphragm separates the two important parts of our body. This portion is known as a thorax and this portion is known as the abdomen. The thorax and the abdomen are separated by this structure. This is known as the diaphragm. That is why the diaphragm is also known as a thoraco-abdominal diaphragm. The diaphragm plays an important role in the mechanism of respiration. That is why it is also known as the principal muscle of respirations. Anatomically, the diaphragm consists of two parts, that is the peripheral part and the central part. This portion is known as the peripheral part. The peripheral part consists of the muscles. This portion is known as the central part. The central part consists of the fibrous part, and this portion is known as the central tendon of the diaphragm. Now this picture is the inferior aspect of the diaphragm. Within this, you can see this white part. This is known as the central tendon of the diaphragm. And this is the peripheral part. This is known as the muscular part of the diaphragm. Now the origin of the diaphragm. The diaphragm consists of the three origins: the sternal part, costal part and the vertebral part. The name itself denotes from where the origin takes place. The sternal part. The sternum is divided into the three parts. The uppermost part is known as a manubrum. This portion is known as the body of the sternum and this portion is known as a gypoid process. From the posterior surface of the gypoid process, there is presence of the two fleshy muscles which take origins from the posterior surface of the gypoid process. Now another origin that takes place from the costal. It is also known as from the ribs. From the east side, it takes origins consist of the six placious lips, which arises from the inner surface of the lower six ribs near their costal cartilage. Now the vertebral part. The vertebral part, that means it takes origin from the vertebra. It takes origin from the vertebra by the means of the two crura, which is known as the right cross and the left cross of the diaphragm, and also from the five arcuate ligaments. Now this portion is known as the vertebra, which is present in the posteriorly, whereas it has the origin of the diaphragm with the formations of this is known as the right cross of the diaphragm, this is known as the left cross of the diaphragm. Together it is known as the crura of the diaphragm. Along with that, there is the presence of the five arcuate ligaments. This is one arcuate ligament which is present. This is known as a median arcuate ligament. Then laterally there is the presence of the one more arcuate ligaments. This is known as a medial arcuate ligaments. When you go more laterally, there is the presence of the one more arcuate ligaments. This is known as a lateral arcuate ligaments. The medial consists of the right and the left. The lateral consists of the right and the left. One arcuate ligaments, this is the lateral arcuate ligaments, medial arcuate ligaments, median arcuate ligaments, medial arcuate ligaments, and the lateral arcuate ligaments. Together it is forming the 5 arcuate ligaments. Now the crura, which I was talking before, it consists of the right cross and the left cross. The right and the left cross together, it's a plural form which is known as a crura. Now this portion is known as the right cross of the diaphragm, which is present in the right side. It is the vertically placed, and it is a vertically placed fleshy muscles that is present in the anterior surface of the body of the lumbar vertebra. It extends from the L1, L2 and the L3 lumbar vertebra. Along with that, the intervertebral disc that is present between there. One more crura that is present, this is known as a right crura cross, which is also a vertical fleshy slip that is present in the anterior aspect of the left side of the lumbar vertebra. The difference between the right and the left, you can make out the right cross of the diaphragm is longer than the left cross of the diaphragm. It arises from the anterior aspect of the upper 2 lumbar vertebra and also the intervertebral disc. This is the origins of the left cross of the diaphragm. Now the arcuate ligaments. In the middle, there is a presence of this arcuate ligaments. This is known as a median arcuate ligaments. It is the arc form that is present in between the 2 crura. That is this is known as a right cross and this is known as a left cross. This is formed by the thickening of these sheets that is known as the psoas sheets. Now another arcuate ligaments that is present, this is known as the medial arcuate ligaments. This portion is known as the medial arcuate ligaments. It extends from the side of the vertebra. Now you can see in these pictures, it extends from the side of the vertebra of the L2, then it goes to the tip of the transverse process of the L1 vertebra. This is the tip of the transverse process of the L1 vertebra. That is the extent of the medial arcuate ligaments. Now the lateral arcuate ligaments. The lateral arcuate ligaments is the thickened upper margin of the fascia that covers the muscles, the fascia that covers this muscle, which is known as the quadratus lumborum. The fascia get thickened and get attached to this. This is known as a L1, the tip of the transverse process of the L1 vertebra, which extend laterally to this area, which is known as the 12 ribs. And this portion is known as the lateral arcuate ligaments. Now the insertions. The insertions of the diaphragm is trifold in shape. It consists of the anterior leaflet. This portion is known as the anterior leaflet. Then after that, the tongue-like projection that is present, this portion is known as the posterior leaflet. The posterior leaflet also consists of the right posterior leaflet, and this is known as the left posterior leaflet. You can see the right posterior leaflet is the short and it's stunt, whereas the posterior left side leaflet is thin and it is long. This central part gets fused with the fibrous pericardium. Now the central part is near to this, that is the sternum. Whereas when you compare to the vertebra, the distance between the central tendon of the diaphragm and to the vertebra, it is longer. Now the surfaces and the relations. This is the superior surface of the diaphragm. Towards the superior surface of the diaphragm, there is the presence of the projections which is present. This is known as a cupola, and it is the dome shaped. This projection will face us to this cavity which is present. This is known as a thoracic cavity. In the central, there is a presence of the depressed between this dome shape. This is known as a central tendon of the diaphragm. The superior surface of the diaphragm is covered by the fascia, which is the endothoracic fascia. Whereas the dome or the cupola of the diaphragm, in the superior surface, there is the presence of the base of the right and the left pleura on each side. Along with that, in the central, there is the presence of the fibrous pericardium. Now, in the inferior surface, it is lined by the fascia, which is known as the diaphragmatic fascia. Along with the parietal peritoneum will be present. Again, this is the inferior surface of the diaphragm. In the inferior surface of the diaphragm, it is covered by the fascia, which is known as the diaphragmatic fascia. And also there is the presence of the peritoneum, which is known as the parietal peritoneum. On the right side of the inferior aspect of the diaphragm, there is the presence of this lobe, which is known as the right lobe of the liver. Along with that, the right kidney will be present and the right suprarenal gland will be present. On the left side, there is a presence of this structure, which is known as the fundus of the stomach. And also there is the extensions of this liver, which is the left lobe of the liver. The spleen will be related. Along with that, left kidney and the left suprarenal glands will be present. Now the important part of the diaphragm is that the diaphragm consists of the opening. It's considered two types of the opening, major opening and the minor opening. Within this major opening, there are the three openings. The one opening that is present, this opening which is present, the central tendon of the diaphragm, this is known as a carval opening. This carval opening is present in the central tendon, which is slightly to the right of the median plane between the central and the right posterior leaflet. The shape of it is a quadrangular in shape or square in shape. The vertebral liver is the T8. One more opening that is present, this opening, this is known as the esophageal hiatus. This esophageal hiatus is slightly to the left of the median plane, and it is usually formed by the fibers of the right cross of the diaphragm, which split around an opening and act as a pincock. You can see this is known as the right cross of the diaphragm. This right cross of the diaphragm will form a slit, and it forms one more opening, and this opening is known as the esophageal hiatus. The shape of the esophageal hiatus is about oval in shape. The vertebral level is the T10. Now one more opening present in the midline, this is known as the aortic hiatus. This aortic hiatus is present in the midline just behind the median arcuate ligaments. It is circular in shape or rounded. The vertebral level is the T12. Now the structure that passes through the three major openings. From the vena cava opening, the structure that passes is the inferior vena cava, and the right phrenic nerve. From the esophageal opening, the structure that passes is the esophagus, right and the left vagal trunk, and also the esophageal branch of the left gastric artery. From the aortic opening, the structure that passes from the right to the left side, there is a present azygous vein, thoracic duct, and the aorta. Now, after finishing the major opening, there is a presence of the minor opening. The minor openings are the superior epigastric vessels passes through the gap, which is also known as the space of Larry, which is present between the muscular slits arising from the Gifford process and the seventh costal cartilage. Musculophrenic artery, which passes through the gap between the slits of the origins of the 7th to the 8th ribs. Lower 5 intercostal nerves and the vessel that is from the 7th to the 11th, it passes through the gap between the adjoining costal slits. Subcostal nerve and the vessel passes deep to the lateral arcuate ligaments. Sympathetic chain passes deep to the medial arcuate ligaments. Greater, lesser, and the less splenic nerve passes by piercing the cross of the diaphragm on the cross-veinic side. Hemiazygous vein pierces the left cross of the diaphragm. These are the minor opening that is present in the diaphragm. Now the nerve supply. It is supplied by this nerve, which is known as the right phrenic nerve and the left phrenic nerve. And also it is supplied by the lower lower 5 intercostal and the subcostal nerves. Now the artery supply. The superior phrenic artery, which is also known as a phrenic artery, it is a branch from the thoracic aorta. Inferior phrenic arteries from the abdominal aorta. Pericardial phrenic arteries, which arises from the internal thoracic arteries. Musculophrenic arteries, it is a terminal branch of the internal thoracic artery. Superior epigastric arteries is the terminal branch of the internal thoracic artery. Lower 5 intercostal and the subcostal arteries. These are the artery supply of the diaphragm. Now the lymphatic drainage. Anterior diaphragmatic lymph nodes. This portion is known as the anterior diaphragmatic lymph nodes, which is present just behind the Gifford process. The posterior diaphragmatic lymph nodes, which is present around this orifice, which is known as the aortic orifice. This portion is known as the posterior diaphragmatic lymph nodes. The lateral diaphragmatic lymph nodes consist of the right side and the left side. The right lateral diaphragmatic lymph nodes is situated near the caval opening, whereas the left diaphragmatic lymph nodes, that is the lateral part, which is situated near the esophageal opening. Now this finishes the topic, that is the diaphragm. Hope you like it and subscribe my channel. Thank you.